Hi there, First Baptist friends. I'm glad to be coming to you today. I want to give you a little peek inside the decision-making process as we think about how to safely reopen our sanctuary for worship. The important thing to remember in this whole pandemic is that any of us can catch the virus that develops into COVID-19. Some of us are at higher risk for developing serious complications. People who are over the age of 65, people with underlying health conditions like heart disease, diabetes, and asthma, and people who have compromised immune systems. But no matter your age or health status, you can catch the virus and you can spread the virus to others, even if you have no symptoms. So when we made the decision to close in mid-March, we did so with two objectives. One was to stop the spread of the virus among our worshipers, and the other was to participate in an objective known as flattening the curve. The idea was to slow the spread of the virus enough so that our healthcare systems did not become overwhelmed. And so now that the curve has been flattened, we find more businesses and organizations, and yes, churches, starting to reopen. On April 28th, the Church Advisory Council and staff met to decide how to do that safely. And we were armed with information from the Tennessee Department of Health, the University of Washington Institute for Health Metrics, and best practices from faith communities around the country. And when we met that evening by Zoom, of course, we decided to keep things closed through the month of May, hoping that we could have a quick return to worship after that. The Cooperative Baptist Fellowship has now issued some guidelines that we are using in our decision-making process. The guidelines from CBF are tied to benchmarks in public health issued by the federal government as part of their Opening America Again plan. And so we're going to take a look at some of the metrics that we use. There are three categories of criteria that are used for that Opening America Again plan, but we're going to be concentrating on the things that we have access to easily and can interpret fairly straightforwardly. So here's what we're going to be looking for. A downward trajectory of documented cases within a 14-day period, or a downward trajectory of positive tests as a percent of total tests within a 14-day period, assuming a flat or increasing volume of tests. Ken Morton has been tracking these numbers since early March, and we're monitoring the 16 counties that the health department calls East Tennessee. You might think, well, there are so few cases in our own county, why should we be looking? But we know people don't just stay in Jefferson County. They go to surrounding counties to visit family or to go to the doctor or to shop or to go to work. And so it's important for us to keep an eye on those surrounding counties as well so that we can make sure we don't miss a trend that would make it unsafe for us to open, because those trends around us might show up in our county, but just a little bit later. And so we're going to take a look at a couple of graphs. And the first one is the number of active cases. So you can see that East Tennessee was in a downward trend in mid-April, and there was a spike at the end of April that corresponded to outbreaks in a correctional facility and a nursing home. And given that there is less risk to the public because those facilities are locked down, we had kind of hoped that the downward trend would just resume. But you can see that the pattern is really erratic and we don't yet have a real downward trajectory. So you might say, well, we're doing a lot more testing, so of course we're getting a lot more positive cases, and that is true. So the other metric that we look at is the percentage of positive results. So the graph on the left side of your screen shows that our testing capacity continues to increase, and that's a good sign. We're doing more and more testing. The graph on the right shows the percentage of tests that have positive results. And while our percentages have largely remained under 10%, that's a good sign, you can see that we're not really on the downhill side of things. Even if you disregard that late April spike from the jail and the nursing home, you can see that the pattern remains erratic. We don't have a good downward trajectory yet. So those are the two primary measures that the Church Advisory Council is looking at as we move forward and trying to figure out when we can reopen safely. We need 14 days of that downward trajectory before we can move into phase 1. So let's take a look at what phase 1 looks like. During phase 1, worship remains online. Our staff will continue to work mostly from home, but we'll have more flexibility to be in the building when it's necessary. Very small groups like committees or staff might be able to meet in person, but they will have to follow proper social distancing and hygiene protocols, including the wearing of face masks. And those at high risk of developing serious complications are advised to continue staying home. Now, in order to move to phase 2, we have to satisfy that same gating criteria again. So another 14 days of continued downward trajectory in the number of active cases or in the percentage of positive test results that are coming back. Let's take a look at what phase 2 looks like. In phase 2, we can begin having worship in the sanctuary again with restrictions that include social distancing and the wearing of face masks. Staff may return to the office. Individuals at high risk should continue to stay home. After meeting the gating criteria a third time, another 14 days of downward trajectory, we move into phase 3. The number of worshipers in the service may increase, but distancing should continue. Other programs may be resumed after considering risk and mitigating them as much as possible. Individuals at high risk should limit public interaction, but they may find that returning to worship is possible. The sudden closure of our sanctuary meant that we had to pivot to online worship very quickly. And I want to assure you that we are not going to go backwards on that score. We were already exploring how to live stream our worship before things changed mid-March, and we are on a faster track with that. So if you are at high risk and we open the sanctuary back up and you are not comfortable coming back to worship immediately, you will still have a worship experience available to you. We will continue to provide something by video. We're getting better at it. I think we're getting a little faster at producing it. And so we want to make sure that you still have that opportunity. In addition, we're looking at other ways that we can see one another. We have a fun activity coming up on the 23rd that we're going to explore more and tell you more about in a couple of days, where you will have the opportunity to come up to the church property. And so I'm excited about sharing that with you in a couple of days. In the meantime, please stay safe and well. We will keep watching the numbers, and as we have more information, we'll let you know more so that you can feel up to date on how we're making our decisions during this time. I hope you have a wonderful evening. Go in peace.